Hi, Dr. Steve Segal from LibertyvilleChiropractor.com. Today I want to talk about an article that just came out. It's in the American Journal of Psychiatry, October 3rd. And in essence, what this article is about is how to prevent depression with exercise. And as you can see from the title, it says small dose exercise guards against depression. An hour a week of low intensity exercise may be all it takes to prevent depression, a large population based cohort study of healthy adults suggests. And so it goes in here. There's this doctor out in, where is he? At the United Kingdom. He told Medscape News, so if physicians have a patient with a history of depression, this advice is probably particularly important. Do regular small amounts of enjoyable exercise. Patients don't have to run a marathon. Excuse me. Um, Enjoyable exercise? Well, some people enjoy it, some people don't. The whole idea is to create motion. Now, here it says no added benefit beyond 1 hour. During this study, what they did was between 1984 and 1986 in Norway. Let me see here. Yep, in Norway, what they did, they invited people ages 20 and older to respond to questions about their lifestyle and medical history. They also underwent a physical exam. A total of 74,599 people, well, 74,000 and a half, responded to the survey. All participants were followed for a period of 9 to 13 years during phase 2 of the study. At the time of the baseline, all participants were asked how often they engage in exercise, such as walking or swimming. The researchers graded the intensity of the exercise based on answers to questions as to whether the participants exercised without becoming breathless or sweating, whether the exercise resulted in breathless or sweating, or exercise resulted in near exhaustion. A total of 22,564 individuals were successfully assessed during phase 2 of the Hunt study. The authors stressed that this is a very healthy cohort of individuals at the study outset. The participants, younger participants and women, were significantly more likely to undergo follow-up assessment. And so, after adjustment for a range of confounders, those who reported undertaking no exercise at baseline had a 44% increased odds of developing case level depression compared to those who were exercising 1 to 2 hours a week. They also found a significant negative relationship between the total amount of exercise taken at baseline and the risk of future depression. They also determined that everyone exercised at least 1 hour per week, 12% of the cases of depression that were identified at follow-up could have been prevented. The same was not true for anxiety, the prevalence of which is similar at follow-up, regardless of the level of baseline exercise. Most of the protective effects of exercise is realized with relatively low levels of exercise, with no indication of any benefit beyond 1 hour of exercise. So if there's 168 hours in the week, and you only have to work out 1 hour a week, you could probably split it up into three 20-minute sections, and you still have 167 hours to yourself. The protective effect of exercise on depression was seen equally across all groups, regardless of the intensity of the exercise that was undertaken, or the gender or the age of the participants. The results of this study indicate that relatively modest increases in the overall amount of time spent exercising per week may be able to prevent a substantial number of new cases of depression. Now, these are confirmatory findings. Commenting on the findings from Medscape News, a researcher at the Karolinska Institute of Stockholm, Sweden, said a study he conducted in the treatment of mild to moderate depression yields similar results. That study involved 946 patients with mild to moderate depression who were assigned to either undergo yoga or stretching, moderate aerobic exercise, or vigorous aerobic exercise. Patients were encouraged to participate in 3 exercise sessions a week, but most only attended about one per week. At the end of the 12 weeks, Dr. Helgren and colleagues found that the severity of depression was significantly lower among patients who participated in any one of the exercise interventions compared to those who received usual care, and the benefits of the exercise were seen regardless of how intense the patients exercised. Again, they just had to go create motion. Furthermore, the benefits of exercise on depression were maintained 12 months after baseline assessment despite suboptimal adherence. So, if they didn't exercise at the regular frequency, they still did great, not only then, but for up to 12 months afterwards. He said, I think the recommendation should not be to exercise only once a week because people need to exercise more than once a week for general health. For that reason alone, we should recommend that people exercise 3 times a week. But even if they exercise only once a week, exercise can still have beneficial effects on depression. Exercise is medicine for depression, even when the pill is small. So this is just a tremendous article. It recently came out, and how motion and chemistry and depression are intimately affected. My name's Dr. Steve Segal, bringing you some of the latest news that can change your life quickly. Any questions or concerns, give me a call or text. My cell number is 847-778-3627. And again, this is Liberty.